Hello everyone. Today's video is about a patient that I just followed up with recently and had some really cool results from taking MSM, which is high doses of MSM, which is a form of sulfur replenishment therapy. And I just wanted to share that with you folks because it's a really cool story and I'm excited about it. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need healthcare advice or medical advice, please talk to your healthcare provider to get that advice. So this is a patient I've been working with for a number of years. A lot of complex chronic health issues, fatigue issues, chronic pain, chronic digestive issues, a host of different autoimmune conditions, issues with like severe, a variety of severe symptoms, some cognitive challenges, brain fog challenges, weight management challenges, like just you name it. Like this patient has a lot of stuff going on, but thankfully they have really persevered. They have worked with a lot of different treatments, have been very steadfast, and have made some really amazing headway over the course of time. So, anyways, hats off to their perseverance. And so one of the things that we started probably the better part of 6 months ago, I would say, is I started taking some MSM. Now, I've posted quite a few videos about MSM or high-dose sulfur therapy. Please cross-reference those videos if you're interested in a little bit more of the background of this. I had a podcast interview with Dr. Kathleen Janelle, who's a leading expert in high-dose sulfur therapy / MSM therapy. And so you can check my podcast interview with her. It's easy to search for that on podcast platforms or on my YouTube channel. But anyways, so we started this high-dose sulfur therapy. We started very low and slow because this patient is also, with all the things going on, they're also very sensitive, not to everything, but to a lot of things. So we started very low, built up gradually. There were different detox symptoms that came up. There was some like kind of building up and then having to pull back on the dose. So that's why, it was started 6 months ago, but it was probably within the last month or so that the patient has been up to a more robust dose. I think they're, around like maybe 50% of the optimal target dose. We're aiming for about 30 grams, 30,000 milligrams a day for this particular case. So they're, up around like half of that dose, give or take. And so it's oftentimes around that kind of dosing range where that's where we'll start to see, the needle start to shift. Sometimes we see changes at lower dosages than that, and sometimes we don't see dosage or clinical improvements until we get closer to the full therapeutic dose. But, oftentimes like this is where we'll start to see some change, especially if it is quite a low and slow buildup or like a very gradual buildup of dose. It's like, even though we're not at the full therapeutic dose, it's taken so long to build up there that you put in enough days of a lower dose, it gradually kind of has a cumulative effect over time to gradually start making some shifts. So anyways, we recently had a follow-up, and I was very happy to hear that there were some like really big changes with this patient. So the one thing is that the patient's nails are growing like crazy. Now that maybe doesn't sound like the most exciting climactic thing, but this is a patient where like they have a history of like a lot of malabsorption challenges, a lot of the signs of like just sort of healthy absorption, healthy physiology, like healthy skin, healthy hair, healthy eyes, healthy just normal bodily functions, healthy normal healthy nail growth. This is like showing signs that like there's actually some proper, some signs of like good normal physiological health happening. And the patient's like, yeah, like my nails have not grown like this in forever. It's like, yes, MSM is so good at doing that for so many folks that take it. So that was very exciting. The other thing is that their hair is starting to grow significantly. And this is also something that has been a challenge for a long time. Thyroid challenges, just, a lot of like issues with, hair thinning, hair breaking, that type of thing. So hair growth is happening. It's like, yes, that is another thing that we see with MSM on a very regular basis when folks are taking a high enough dose. So that was also exciting. There's one other thing which I think is the coolest one of all. Those are like good for sure, very exciting, but I'll save the best one for last year. But the other one that I forgot about is that even as the patient was gradually building up the dose of MSM, even like back in the earlier days of being down at say like maybe 5,000 or 6,000 milligrams, one change that we saw fairly early was some significant improvement in bowel normalization. So that was really exciting to see. So this individual for many moons, like they have some significant nerve issues, kind of a challenge with not really having very much sensation in certain areas of the body, and that of course can lead to skewed signals where it's like, oh, like, do I need to have a bowel movement, not have a bowel movement? Am I getting the signal? Am I not getting the signal? And so that was another positive change that we had seen even earlier in the dosing escalation. But the last thing that came up, which is really cool, is that this individual has Sjogren syndrome. And Sjogren syndrome is this autoimmune condition that's characterized with a lot of dryness issues, like, dry skin, dry throat, dry mouth, dry eyes, and tied in with that would be like a lack of saliva production, and sometimes lack of tears. And so what's really cool is that this patient who has had this hyposalivation issue, like very, lack of saliva production for many, many moons, like I think 20 plus years, is now producing saliva, which is really cool. So that's something that's not really supposed to be medically possible, but it's happening. So as much as, in the grand scheme of things, it's kind of like, saliva production versus, chronic pain issues, chronic fatigue issues, whatever. It's like, as much as it might seem like a bit of a little thing, it's like, it's pretty fantastic and pretty fascinating when something that's not really medically supposed to be able to happen without, I don't know, using sialagogue, like, saliva stimulants or something like that. It's actually happening. And we're actually seeing this meaningful improvements in this individual's basic physiological function. So anyways, just wanted to post this quick video about this case because I was just very, very excited about it. It's like really cool when we see things like that happen, and I just really, really love high-dose sulfur therapy. It can be so helpful for a lot of folks. So if you've made it this far in the video and you're thinking like, oh, like that sounds really cool, but like my nails are fine, my hair is fine, my saliva is fine, my bowels are moving well, high-dose sulfur therapy / MSM can be also applicable for, and it's most commonly applicable for chronic digestive issues, particularly gas and bloating, can help with intestinal healing, can help with bladder healing. It can be helpful for connective tissue support, so issues with joints and muscles, and then it's also important for detoxification function as well. Some patients find that it has blood flow enhancing effects, so it does have a wide variety of different effects, but the growth of hair and nails is kind of just this common side effect, and oftentimes a kind of a welcome side effect for folks like, oh, who doesn't want to have more luxurious hair, I suppose. Yeah, so those are, anyways, a couple of welcome side effects. If you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. If you have any questions or comments on these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.